an oscillatory technique. They're really one and the same. The pin and stretch is going to mimic more of like an effleurage, right? Whereas the oscillatory is going to mimic more of a friction, right? But instead of me frictioning over their skin, I'm having the layers beneath friction, okay? So first one, Infraspinatus and Teres minor, we're going to group together because they're best friends. They do the same thing. So very easy to work. So I can start. We'll go origin towards insertion, pin. Now what does Infraspinatus do? Remember, it likes to go towards external rotation. So this is in its shortened state. So once I start moving towards internal rotation, it's lengthening. So I'm going to do that pin and stretch. I'm going to start him in a little bit of a shortened position. So externally rotate the arm. Pin, we'll go origin first. And then I'm taking him towards internal rotation. Then reset. So I'm starting him in external rotation, and then I'm just rotating that arm. You see it moving? Especially as I get this way, it's starting to lengthen, starts to flatten, right? Starting to compress down because it's starting to stretch and lengthen. I'm not pressing very hard. If I wanted to, I could be really mean, especially right in the belly. You can usually, yeah, send it, full send. Get in there. They're going to feel it more as you get back here. Usually fight against you. I'm going to keep going towards the insertion right along that edge of the deltoid. You will feel it. Keep going, keep going. Once you get towards the insertion, you're going to have to press a little harder. Right, we can come back. Now the nice thing about Teres minor is it does the same thing. So I'm just going to move towards the edge, and now I'm more on Teres minor. So I'm doing the same thing, right? Because it's the same thing. It's an external rotator. So as long as I'm taking him into internal rotation, I'm getting a little bit of lengthening of that tissue. Now the only difference, if I want to do an oscillatory technique, let's say I feel kind of a trigger point or a little area of density, I can hold it. And all I'm going to do is just gently shake his arm like this. And when I do that, there's just a little bit of shortening and lengthening happening under my pressure. So it's almost like I'm mimicking friction. Just shaking his hand. And you'll feel it move. You can also do this with your knee if you're real lazy like me.
I feel it down my arm.
That's usually a sign of a trigger point. When they have referred pain down a specific myofascial length, it's usually a trigger point. You can be real lazy. I do this all the time. My therapies, or I'll go this way. Just kind of, yeah, you know what I'm saying? You gotta learn to be lazy, you know what I mean? You can do the same thing, just a little bit of friction, friction-like therapy. Again, you don't have to use your thumb. You can use knuckles. You could use an elbow. This is usually a sensitive area though, infraspinatus. So I only do this to people if I want to be mean. Or if they're a big bodybuilder and I need to really like get some into them, you know. You ready to try it? Super simple. Start with